Hi, my name is Dr. Pradeep Haranahalli. I am working as a consultant cardiologist at Manipal Hospital, Whitefield, Bangalore. Pulmonary hypertension is a general term which is used to denote increased pressure in the blood vessels supplying blood to the lungs. In turn, right side of the heart also will have increased blood pressure. This is entirely different from the elevated blood pressure we commonly talk about, which denotes systemic blood pressure, that is on the left part of the heart. Pulmonary hypertension is mainly caused due to narrowing or destruction of or clot formation in the blood vessels of the lungs. Thus, the blood flow becomes sluggish in the lungs, which in turn leads to elevated blood pressure in the right side of the heart. Thus, the right heart has to work more harder to keep the blood circulation into the lungs. When it continues to do so over a period of time, the right heart starts failing. There are various causes of pulmonary artery hypertension, out of which there are 5 main important reasons behind pulmonary artery hypertension. It is very important and crucial to identify each individual type because each individual type is managed differently. The medications chosen for managing these conditions are totally different. As far as diagnosis of pulmonary artery hypertension is concerned, it is much delayed by the time we start identifying or recognizing this condition, for the very reason that it do not have any specific symptoms or symptoms very unique to pulmonary artery hypertension. All the symptoms what we commonly appreciate are shortness of breath, effort intolerance, palpitation or near fainting like situation, sometimes chest pain. All these symptoms are more generic to other cardiac problems or even some of the common conditions like asthma. So this leads to delay in recognition and early initiation of treatment in pulmonary artery hypertension. So the diagnostic test could be like echocardiogram, CT pulmonary angiogram are all beneficial in identifying this condition, and once identified, there is no Indian data to exactly specify the incidence of pulmonary hypertension. However, Western literature says it is 5 to 7 cases per million per year, and we all assume the same is the case with Indian population as well. And when we talk about risk factors, it is commonly diagnosed among women in their 20 to 30 years age group, and some of the conditions like inborn defects of the heart, liver conditions, chronic kidney disease, and use of alcohol, and some of the medications like the performance enhancing drugs or cocaine are all known to lead to pulmonary artery hypertension. When we talk about treatment, there is no cure to pulmonary hypertension. As we discussed, there are 5 important causes. Each one is handled in a different way, and your doctor can help you through the process of treatment. There is no cure. However, there are effective medications which can improve the blood flow, reduce the symptoms, delay the progression, or improve the quality of life in patients with pulmonary artery hypertension. They should continue to follow with their cardiologist, pulmonologist or physician through the care of pulmonary artery hypertension. It is effectively treatable. Still, there are a lot of unmet need in treating pulmonary artery hypertension, and we hope the future has more answers to treatment of pulmonary artery hypertension. Thank you.